Hi, welcome to Establishing Breastfeeding at Ashford. My name's Virginia, and today I'm going to go through the most commonly asked questions associated with establishing your breastfeeding. Now we've got half an hour, and believe it or not, that's all we need. You are having your babies at a time when there is so much information at your fingertips. You've got Dr. Google, you've got well-meaning relatives and girlfriends, but you'll be pleased to know that I've taken all the information out there and I've condensed it into the evidence-based information that you need to know to establish your breastfeeding. Like anything you do for the first time, establishing your breastfeeding can either go really smoothly or it can be quite challenging, and that's why the dedicated midwives Ashford are here to support you. Now, the World Health Organisation recommend that you breastfeed your baby within the first hour of birth. Now, that's because your baby is at its most alert in the first hour, and also we want that rich, thick colostrum to line the baby's gut, and it's an antibacterial protective layer that stops your baby getting all sorts of infections. The other thing that the colostrum will do is start the baby's digestive process working, and that's really important because baby is born with a tummy full of mucus and amniotic fluid, and we need baby to digest that so they don't bring it up and then sort of get uncomfortable and choke on it, so to speak. So basically we want them to have a tummy full of colostrum in that first hour, and we hope that they get that with the first breastfeed. The World Health Organisation recommend that you breastfeed your baby for the first 6 months. That's because the breast milk provides everything that your baby needs. Now, when you get admitted to Ashford, you will be provided with this Establishing Breastfeeding booklet, which lists the benefits of breastfeeding for 6 months to both mother and baby. Okay, your breasts are very, very clever. They've been producing colostrum since you were 16 weeks pregnant. And there's actually nothing that you need to do to prepare your breasts or your nipples for breastfeeding. So closer to your due date, you will notice some changes to your breasts. The first one is they'll become what we call more veiny. So you'll notice increased vasculature, and that's just getting ready for breast milk production. The other thing you'll notice is that the areola and nipple will darken. And that's nature's very clever way of giving babies somewhere to aim at. You might also notice that these little glands around the areola, they're called Montgomery's glands, they actually enlarge. Now that's quite normal, there's nothing wrong with your breast at all, and they actually secrete a fluid that keeps the nipple and areola supple and sterile. Now, it's really important, even though you are pregnant and once you're breastfeeding, and I think for the rest of your life actually, to remember to examine your breasts every single day in the shower. Remember that breast tissue starts underneath the axilla and comes right underneath. So that breast self-examination, if you can do that every day in the shower, that would be great. And listen, if you notice any changes while you're pregnant or after you've had your baby, any lumps or bumps or anything unusual, any discharge from your nipple, please make sure that you talk to your GP or obstetrician. There's a few things you can buy for your breasts before you come in. One of those is some Bond singlets. These are great because they're a top, pyjamas and a bra all in one. I would probably get about 3 to 5 of these. They come in all different colours and they're very, very handy. I would also buy at least 2 to 3 maternity bras. Now, you can test the quality of these if you can undo it with one hand, which is really important because you'll be holding the baby with the other. The other thing you can buy is some Lansano ointment, and 1 packet of breast pads is all you'll need for hospital. So the World Health Organisation recommend that you breastfeed your baby within the first hour of birth. Now this is because the baby is at its most alert that it will be for the next couple of weeks. We also want to line the baby's gut with that rich antibacterial colostrum, and ideally that can be done within the first hour. Now there's 2 different scenarios for the first feed. One is in the birthing suite if you have a vaginal birth, and the other is in the recovery if you have a Caesar. Now, if you have a vaginal birth, once baby's born, baby will be placed onto your chest and you'll be covered with a beautiful warm towel or blanket. Your partner can come around and cuddle in. And there's a few things we need to do before the baby has the feed, and that is just to clamp, and then your partner can cut the cord. We need to give the baby some vitamin K, and we need to pop on some name bands. Once that's done and you're comfortable, the midwife can help you position baby onto your chest, and the baby can have a feed. Now, sometimes the babies have blocked noses, or they're just not interested. Basically because they've been well fed in utero, they've got tummies full of amniotic fluid, and they've got lots of brown fat around their major organs. They're not always hungry, in other words. We do keep a little eye on the clock in some respects within this first hour, because we do like the baby to have a tummy full of colostrum. If possible. So if baby's definitely not interested in that first hour, you can ask the midwife to help you express some colostrum, and we can offer it to the baby with a syringe, just a little finger feed of the colostrum. And if the baby gets a little taste of that colostrum, quite often then you can offer them the breast, and they're quite happy to feed. So once baby's had a feed in birthing suite, we can then go on and do the weight and measure the baby's length and head circumference. We always wait until after baby's had a feed though, because we don't want to tire a baby out with all that sort of business. Once baby's had a feed and we've weighed baby and everything, then you're ready for a shower. Now, it's really important that in the shower you don't wash the top layer off where you've had baby skin to skin, because the baby then goes back to that scent and recognises that scent. If you've had a caesarean, then the first feed will be in recovery. Now, once the nurses have you settled in recovery, we can then go on and weigh the baby. Now, we're going to gently unwrap, and we're going to gently place baby on the scales, do length and head circumference. And then, like I said, once you're settled, we'll be ready for skin to skin and that first feed. So basically, we just position you upright a little bit, make sure you're comfortable, pop baby on your chest. Now, these babies are very, very clever and they know what to do. We'll just help you to position and to shape your breast, and the baby will hopefully get on and have a reasonable feed. We'll offer both sides to the baby, and it's the same scenario. If the baby's not interested in feeding, we can offer a finger feed. Once baby's had a good breastfeed or a finger feed and a cuddle, then we take baby up to the nursery where we do an oxygen check and a temperature check and pop some new name bands on the baby, and then it won't be very long until you're up from recovery and you're all together. Nature's very, very clever. As soon as the baby's born and your placenta is delivered, your progesterone levels will drop and your prolactin levels will rise, and the milk will come in over 3 to 4 days. Now, everyone's milk comes in on a different day. Sometimes it might be 48 hours, it might be 72 hours. But to start with, the colostrum is a rich, thick, sticky substance, and when your milk comes in, it changes to a white, bluish, more watery substance. Now, like everything, we try and keep it simple. How do we know when baby needs a feed? Well, we look for early cues or late cues. Early cues that your baby might be hungry or thirsty will be that they'll just start wriggling in their cot. They might start mouthing, sucking their little finger, or if mum's holding them, they'll start rooting around looking for the breast. Late cues, either crying or being too sleepy, so they've been passed around from visitor to visitor. They're so content and so sleepy that they're too sleepy to feed. Again, keep it simple. Babies feed for hunger, thirst and comfort. On average, they feed around 8 to 12 times a day, 7 being an average, but remember, watch your baby and not the clock. Typically, in the first 24 hours, your baby will only ask for a feed around about every 6 hours. Second 24 hours, they'll be asking for it about 3 to 4 hourly. And the third 24 hours, when they're waiting for the tap to be turned on, they might start asking for a feed every 1 to 2 hours. Now, Now remember, if you can, try and keep feeds to an hour, because once you get home, you still need to cook, clean, wash, iron, pay the bills and whatever, and baby's got all night and all day to feed if they want, but it'd be ideal for you so that you can get some rest and sleep if you can keep that feed to an hour. Okay, comfortable positioning and attaching the baby are the keys to successful breastfeeding. Now, like everything, we try and keep it simple, all right? So just pop baby's bottom in your elbow. Keep your arm nice and straight. We want a really straight wrist. Drop the baby's bottom down to a 45-degree angle and always bring chin into breast, all right? Now, once you've got baby comfortable, so tucked in your elbow there, and roll the shoulders in, so you could almost walk around the room doing this with the baby, but you can feel that baby feels quite comfortable. The next thing is to shape your breast. Now, shaping the breast comes naturally, it's inherent, but I've got a few tips to ensure that baby gets a big mouthful of the underside of the breast. Now, quite simply, just shape the breast above the baby's nose, where the baby's nose is going to land, and below the baby's chin. That points the nipple up in the air and allows the baby to get a massive mouthful of the underside of the breast, all right? So your thumb is your best friend when you're learning to breastfeed because it keeps the breast stable at the back of the baby's mouth. You'll also notice that when baby first attaches to the breast, it reorganises itself, and if your thumb's keeping the breast stable, it stops the baby coming on and off and then prevents sore nipples. Before we even start to feed, we need to make sure that mum's comfortable. So that will mean if she's had a Caesar, that she needs to be comfortable and propped up in bed and sitting up a little bit. If she's had a vaginal birth or it's day 2 and you're ready to get out of bed, it is much easier when you're establishing your breastfeeding to feed sitting out of bed. Make sure you've got a drink, a comfy seat, a stool for your feet, that you've taken your ice pack out and that your phone's off, and of course that you've got some privacy. You'll need to unwrap baby, undress baby, check the nappy. If they haven't done a wee or a poo, just leave the nappy intact because they'll probably do that while they're feeding. Now, every baby's different. Some babies prefer to be fed wrapped because they've been used to being tight in utero. Others are too sleepy and need to be fed undressed in just a nappy and a singlet. Now, whatever position you're feeding in, the principles remain the same. It's always tummy to mummy, all right? So, tummy to mummy if you're feeding cross cradle, tummy to mummy if you're feeding football hold, and tummy to mummy if you're feeding lying down. So just always remember baby's tummy to mummy and roll the shoulders in. Drop the baby's bottom to a 45-degree angle and that frees up the baby's nose. Now, attaching your baby to the breast. Babies actually attach themselves to the breast. They know what to do. They're born knowing how to suck. So that's a relief for all of us. They're very clever little individuals. But basically we can make it comfortable for the baby and a lot easier for them to attach if they're positioned well. So basically, like I said, just tummy to mummy, bottom in elbow. As far as shaping your breast, just shape it above the baby's nose and below the baby's chin and tip the nipple up in the air and use your thumb to lead the dance. Then I made up a little rhyme for you to make it easier, especially at 3 a.m. and that is chin to breast, nipple to nose, wait till they open their mouth and on they go. 1/3 nipple, 2/3 breast, keep it shaped and don't let go. When the baby's learning to breastfeed, it's too early to let go. If we let go, like I see some new mums doing, their arm comes around here and the baby slips back off onto the nipple. So it's really important to use your thumb to lead the dance in that first couple of days and let your thumb support the breast so it keeps the breast at the back of the baby's mouth. A lot of new mums will be surprised at the strength of the baby's suck. It's quite a strong pulling sensation and we can reassure you that that's quite normal. We know babies attach correctly if they've got a nice big mouthful of the underside of the breast, the bottom lip is flanged right down, and tongue is forward. You also see deep rhythmic jaw movements once baby is attached beautifully. We don't want to see any drawing in of the cheeks or any clicking. Look down at your baby, look at them feeding, and you'll see the fruits of your labour. You'll see that jaw moving, and you can even see some ear movement as well. Now, initially attaching your baby while your nipples are getting used to their new role, it might be a little bit painful. It should only last about 3 or so seconds, and wriggle your toes. Make sure you're stroking the baby's head, and that'll distract you from that initial pain on attachment, and I promise you it will go away. Remember, watch the baby and not the clock, and just feed your baby on demand. Until the milk's in, so until about day 3, I'd offer both breasts each feed, and that'll just give baby some practice and some stimulation. Once the milk's in, the advice changes, and we encourage you to really soften one breast at a time. So it's like having entree and main on one breast, give the baby a bit of a burp, and then offer dessert. And then you can start on the dessert side next time. By really softening one breast, that baby's going to get the hind milk, the high fatty milk that's at the end of the feed, which will help your baby to gain weight. It will help them to settle for longer, and they'll also be less windy. Okay, one of the most common ones, and especially in the first couple of days, is a sleepy baby. Look, all you can do is unwrap, undress, and pop baby onto your chest, and just make sure that they're getting at least 6 feeds in 24 hours. But being sleepy in that first couple of days is quite normal. Now, it's normal for a baby to be unsettled anything from 40 minutes to 4 hours in 24. If a baby's unsettled, they're usually asking for food or comfort. Now, if your baby's unsettled, just use the simple process of elimination. It's either the bum, so they're either wet or dirty. It's either their tum, they're either hungry, thirsty or windy. Or mum, they just want to be held. Or they're too hot, so they're overwrapped or overdressed, or the heater's on too high. Or they're cold, so either underdressed, underwrapped, or the air conditioner's blowing on their face, which they don't like. Now, another challenge is a low milk supply. So in pregnancy, we would expect that you'd have some breast changes. If you haven't had any breast changes in pregnancy, make sure that you communicate that to your midwife on admission, because it might mean that we need to stimulate your breasts a little bit more. There's certain conditions such as hypothyroidism, IVF, gestational diabetes, breast hypoplasia. They're conditions that can lead us to need to stimulate the breast a little bit more than if you didn't have those conditions. Now, we usually know when your milk supply is low, so that's not something that you have to work out for yourself. We just get you feeding your baby more frequently and get you topping up with some extra breast milk. On day 3, we weigh your baby. Now, if your baby loses over 10% of birth weight, that's when we definitely get you feeding your baby more often, and maybe topping up with a bit of breast milk. So oversupply is a great problem to have, and that's easily managed as well. So basically, if you've got so much milk, we just get you to lean back when you feed, and we get you to have baby in a more upright position, and quite often you'll only be feeding one breast at a time. Okay, nipples come in all sorts of shapes and sizes. Some are really short, some are quite inverted, and some nipples are quite large. Now, nature's very clever, and your breasts and nipples will adapt to your baby. There's a few things we can do to help short or inverted nipples. One of those is to sort of roll the nipple around in your fingers, and that will help the nipple to elongate. The other thing is to shape the breast, like I said, with your thumb, and tip the nipple up in the air so that the baby is basically getting a big mouthful of breast, not just the nipple, all right? So if the nipples are short, we counteract that by making sure the baby has a massive mouthful of breast, and so they can pull the breast to the back of the mouth. One option with inverted or really short nipples is a nipple shield. So that's the nipple shield. Your midwife will actually measure you up for those nipple shields while you're in hospital. We don't usually start them until after 48 hours. And the nipple shield, you just basically have to lick the back of the shield and then suction it onto the breast. Make sure you pop some breast milk into the shield, and then the baby needs a big deep mouthful of breast, and they will pull the shield and the nipple into the back of their mouth. But nipple shields really need to be used in consultation with your midwife. Tender nipples are quite common with establishing breastfeeding. They usually peak around about day 3 to day 10. There's lots we can do. Pop a little bit of breast milk onto your nipple after you've fed. Let the nipples air, and most importantly, make sure that the baby's attached correctly and that it's not painful when you're feeding, because that's when some damage can be done. Now, day 3 or 4, when your milk comes through, your breast can feel quite warm, heavy and full. And the term that we use for this is engorged. Now, it's quite normal for breasts to feel like that, and basically we just need to move through that stage using Panadol, anti-inflammatories, and most importantly, feeding your baby on demand. So the best way to alleviate an engorged breast is just to feed the baby. There's certain other things we can do, and that is to massage before a feed, just very, very, very gently. Massage while you're feeding. And then after you've fed the baby, if the breasts are still uncomfortable, you can express until they are comfortable, and or place an ice pack on the breast, and that can be quite soothing. Mastitis is not something that we usually see while you're in hospital. It usually rears its head around about week 2 or 3 when your milk supply is well and truly in. Now, mastitis is evidenced usually by a tender spot felt on the breast. You can also notice that the breast can be quite red as well, so sometimes it can look like that. Now, mastitis can be one of 2 things. It can either be inflammatory, so as a result of the breast milk spilling over into the ducts, and that causes an inflammatory response. Now, if you feel like you have got some signs of mastitis, please take your temperature. Then have some Panadol. Then, if you can, empty the breast with the baby, so give the baby a really good feed, then ice the breast up. If the symptoms don't go away, and the sort of symptoms we're talking about with mastitis would be aches and pains, so you feel quite achy, almost like you're getting the flu, a little bit shivery, and then a high temperature. Now, if your temperature's over 38, you definitely need to either go to the GP or call the locum. If your temperature's under 38 and the symptoms go away within 6 hours, the mastitis is probably just inflammatory. For example, you've slept for 6 hours and the breasts have been overfull. If the symptoms don't go away in 6 hours and your temperature reaches above 38, that's definitely when you need to seek medical advice. So this can be quite tricky if it's after hours as well. So if it's during hours, try and get into your GP. If you feel too unwell or you can't get to the GP, just call a locum to the house. Another alternative is to go to Ashford A&E, and that's open from 8 a.m. in the morning till 10 o'clock at night. What we don't want you doing is coming into the labour ward at Ashford for assessment. Certainly if it's a Tuesday or a Thursday, you're welcome to try and get an appointment at newborn support. With mastitis, it's really important that if the symptoms don't go away in 6 hours, that we treat it with antibiotics. If the oral antibiotics haven't worked after 48 hours, that's when you might need to be admitted to hospital for some intravenous antibiotics. The most important thing with mastitis is to make sure that we're keeping that breast nice and soft every 4 hours or so, and that you're icing the breast. There's quite a bit of warmth associated with mastitis, and we want to ice the breast up to counteract that warmth. So how do we know if baby's getting enough? Well, like everything else, we keep it pretty simple. We look at weight gain. 20 grams a day and about 150 to 250 grams a week, and back to birth weight by 2 weeks of age. By their behaviour, so is baby waking for feeds? That's really, really important. They need to be waking for feeds at least 6 times a day. And are they settling well after feeds? Not after every feed, but for most of the feeds. The other indication is their output. We want at least 1 wee day 1 and up to about 6 wees day 6. Now their poos are going to change in colour. The first couple of days they'll be black, thick, sticky, tarry meconium poos. When your milk comes through, they'll go to greeny poos, and once you're home, we want them to be mustardy. The number of poos they do each 24 hours will change, so will their consistency. Okay, expressing. Let's simplify this. Antenatally, you'd only need to do it if you've got type 1 diabetes or gestational diabetes. It needs to be in consultation with your obstetrician, and you normally do it from 36 weeks. If you're going to start doing antenatal expression, we usually advise that you come for an appointment in newborn support, and we'll give you the kit and all the information that you need. Expressing postnatally, now in the first 48 hours it'll usually be by hand, and your midwife can assist you with all of that. And after 48 hours we use a pump. Now how long to express for and when to express for? You usually express after a feed, and express for as long as you're comfortable. We usually say until the milk stops dripping plus 2 minutes. That way you know the breasts have been adequately stimulated. Now, as far as equipment goes, let's keep it simple. Ideally, if you're going to breastfeed, you just be going home with your breasts and baby, and that would be all you need. However, from a practical point of view, I think it's a really good idea to have at least 2 bottles at home, a bottle brush, a steriliser, and some formula sachets just in case of an emergency. Now, as far as breast pumps go, I probably wouldn't purchase it before you come in and have your baby, but I'd have the money put aside, and the pump that we recommend at the moment is the Spectra, and that's available on spectra.com.au. When you breastfeed, 30% of what you eat goes to making breast milk. So your diet needs to be really nutrient dense. By nutrient dense, I mean 5 colours of vegetables or salad every single day, and at least 2 bits of fruit. You need about 3 litres of water. 1 to 2 coffees a day is fine, and the Australian Breastfeeding Association recommend no alcohol. Once you get home with your baby, there's plenty of help and support. We run newborn support at Ashford now twice a week from 8 till 4. So you can make an appointment, come in and see us, and we can help you with any feeding or settling issues. You've also got child and youth health, and they'll come out to the house and visit you and introduce you to all their services. So although establishing your breastfeeding can be quite intense, we don't want it to be stressful. We want you to enjoy your baby, and that's why all the midwives at Ashford are there to support you.